Hi, my name is Kaylee. I'll be your nurse
Hi.
practitioner today doing a physical exam. I'm going to start out with the cranial nerves. One is olfactory. We won't do that one today. Sense of smell. 2 is optic. We would use a Snellen chart to do that one. We won't do that today for sake of time. 3 is ocular motor. 4 is trochlear. And 6 is abducens, and I will test that with testing your extraocular eye movement, so just follow my finger. Okay, and all of those are intact. 5 is trigeminal, so I'm going to have you clench down, and that's testing the temporalis and masseter muscles. And then, so 5, I already got 6. 7 is facial, so smile real big for me, puff out your cheeks. 7 is intact. 8 is acoustic, can you hear me talking? 9 is glossopharyngeal. 10 is vagus, and 12 is hypoglossal, so I'll have you stick out your tongue, move it from side to side, and then say ah. And I would, for 10, I would test your gag reflex, but we won't do that today. And then 11 is spinal accessory. I'll have you shrug your shoulders. Okay, and that is intact. Okay, so now I'm just going to check your skin, and I will throughout the whole assessment. Skin is pink, warm, and dry. Skin turgor is appropriate. I'm going to check your hands. Hands are pink, warm, and dry. And capillary refill is less than 3 seconds, so that is good. I'm going to inspect your face and your head. Your face looks symmetrical. Skin is warm and dry. Palpating for any lumps. Do you feel any tenderness? Okay, good. Okay, and then I'm going to palpate your sinuses. Let me know if there's any pain. Frontal sinuses.
Nope.
And maxillary sinuses.
Nope.
Okay, great. I am going to check your eyes now. I'm just gonna test accommodation. Can you just follow my finger in? All right, great. The eyes, eyebrows, eyelids, and eyelashes are all intact bilaterally. And I would check all of these bilaterally, but for sake of time, I'll just do one side. I'm going to have you look up and look down. Conjunctiva and sclera are intact and appropriate in color. Sclera is white. Pupils and irises are intact, and I'll have you just look ahead, straight at me. Pupils are 2 and reactive, which is appropriate. So now I'm just going to have you look towards the wall. I would turn off the lights, but today I will leave them on, and I'm going to take a look in your eye. Okay, the red reflex is visible along with the disc and macula and the fundus. Okay. Now I'm going to inspect your ears, your external ear. Ears are symmetrical. I'm going to palpate the auricle and the tragus. Any pain? Okay. I'm going to look in your ear canal. I'm going to inspect the inside of your ear canal. It is intact. Your tympanic membrane is visible. It is a pearly gray color. The cone of light is at 5 o'clock and present, and the integrity is intact in your ear. I would do that bilaterally. I'm going to test your hearing. Let me know if you can hear this.
Yep.
Okay. Switch to the other side.
Yep.
Okay, now I'm going to do the Weber and Rhine test, which tests for conductive hearing loss. So I'm going to hit this and let me know if you can hear it equally on both sides.
Yep.
Okay, and then I'm going to put it behind your ear here. Let me know when you can't hear it anymore, and then I'll put it right beside you and let me know when you can't hear it.
Okay, can't hear it anymore. And can't hear it anymore.
Okay, great. Okay, now I'm going to inspect your nose. Your nose is symmetrical. midline on the face. I'm going to check the patency of your nose. Can you smell both of those? Everything okay right there? Perfect. Now I'm going to inspect the inside of your nares here. Septum is intact and not deviated. The nasal passages were pink, not occluded. Now I'm going to inspect your mouth. Can you open up real big for me? Say ah. Okay. Buccal mucosa is pink and intact. Tongue was pink and intact. Open up again for me. Stick out your tongue. Uvula is present and appears to be normal, and tonsils are +1. And now I'm going to inspect your neck. Neck is symmetrical. I just feel here, no lumps or tenderness there. I'm going to feel your trachea, which is midline. I'm going to palpate your lymph nodes now, your preauricle, postauricle, occipital, super cervical, posterior cervical. I'll be turning your head to your side, deep cervical chain. I'm going to palpate your supraclavicular lymph nodes and infraclavicular lymph nodes, your axillary lymph nodes, and your epitrochlear lymph nodes, along with submandibular and submental and tonsillar. And then I'm going to come behind you and I'm going to have you swallow, feeling your thyroid. Swallow again. Okay, thyroid appears to be intact in an appropriate position. No lesions felt there. So now I'm going to go ahead and go to your back side here. Posterior chest appears to be symmetrical. I am just palpating any tenderness here at all. Okay. I'm going to go ahead and I'm going to have you say 99, checking for tactile firmness.
99, 99, 99, 99.
Okay. And then I am going to listen here. Your shirt would be off, but for the sake of the video, I'll have you leave it on. I'm just going to listen here, so just take a deep breath in and out. Okay, breath sounds are present in all 8 lung fields. So now I'm going to have you say 99.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay, and now I'm going to test agophony, so I'm just going to have you say E.
E, 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 E.
Okay, perfect. And now I'm going to percuss all 8 lung fields. Okay. Take a big deep breath in and out. Okay. Symmetrical rise and fall of the chest. Now I'm going to listen and inspect your posterior chest. Any tenderness upon palpation. Okay. I'm going to listen to those 8 lung fields again on the front side. Okay, and then I'm going to, again, percuss over these areas. again, I'm gonna have you do 99 and E again for me. 99.
99, 99, 99, 99, 99, 99, 99, 99.
Okay, and then I'm going to listen for a murmur. So I'm going to have you lean forward just a little bit. I'm going to listen with the diaphragm and the bell. Aortic valve, which is second intercostal space, right sternal border. And pulmonic valve, second intercostal space, left sternal border. And then again, I would listen with the bell for each of those. Okay, that sounds good. So you can go ahead and lay back. So as I said earlier, the chest is symmetrical. I'm going to palpate the precordium for any tenderness there. Okay. I'm going to palpate for the apical pulse, which is fifth intercostal space. Okay. And now I'm going to listen at the apical pulse there. Okay, I would listen for longer, but rate is 65 and regular. So now I'm going to listen to the 5 heart sounds here. As I mentioned earlier, the first would be aortic, and I would listen with diaphragm and bell. Aortic valve, right sternal border, second intercostal space. Pulmonic, second intercostal space, left sternal border. Erb's point, third intercostal space, left sternal border. Tricuspid, fourth intercostal space, left sternal border. And mitral, fifth intercostal space, midclavicular line, left side. Okay. Now I'm gonna have you stay laying down, and I'm gonna inspect your abdomen. Shirt would be off, but abdomen appears to be flat, non-distended, appropriate in color, and I'm going to listen to all 4 quadrants for bowel sounds. Okay, bowel sounds are active in all 4 quadrants. And then I'm going to percuss over those 4 areas. Okay, and now I'm going to palpate. I'm going to palpate all 4 quadrants, light palpation. You know if there's any tenderness. And then deep palpation. Then I would palpate the liver on the right side. And then palpate the spleen on the left side, I would try to. And then the kidneys bilaterally. And before I would palpate or percuss, I would listen to the aorta with the diaphragm and bell. And then palpate the aorta. And then the renal arteries, the iliac arteries. And while we're doing arteries, I would listen to your carotid. And I would also feel for a pulse on one side, but I would at a time, but I would do that bilaterally. Okay, and then while you're on your back here, I'm going to percuss your liver. I'm going to start down here. Okay, I'm gonna mark that spot. Start from the top. Okay, and then that would be about a 10 centimeter liver span in a male. Okay, I'm gonna actually have you sit up while I'm checking your kidneys. I forgot to check for any CVA tenderness, so I'm gonna, if you feel any tenderness.
Nope.
Okay, perfect. So I think that's good for your abdomen. Now we're gonna go to your lower extremities. Lower extremities appear to be intact. Skin is pink, warm, and dry. Your socks were off. Your feet would appear to be pink, warm, and dry. I'm gonna have you stand up, just testing your range of motion. I'm gonna bend your knees, bend over for me. And checking for scoliosis, any pain there?
Nope.
Okay, and your back looks good. I'm going to have you sit down. I'm gonna test your strength. I'm gonna have you put your arms up, pull towards me, push away, and then same here, push away, and pull towards me. Okay? I'm gonna check your reflexes. First would be your biceps. Okay, and then your triceps. Okay, brachioradialis. Okay, patellar. Okay, and Achilles. And Babinski sign. Okay, thank you. And then I'm going to test if you your sensory. I'm gonna poke you with a sharp or dull object and let me know what you feel. And close your eyes.
Sharp. Sharp. Dull. 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 Sharp. Sharp.
Okay.
Dull. Dull. Sharp. 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 Dull. Dull.
Okay, perfect. I'm gonna have you just close your eyes here and hold out your right hand. I'm gonna put something in your hand and let me know what that is.
Key.
Okay. And another thing, I'm gonna have you hold out your hand.
Cotton ball.
Okay, perfect. And then I'm going to then have you walk around the room. Okay. Very good. And then I'm going to have you stand there with your eyes closed and close your eyes. And I'm testing for Romberg sign, and if that's negative, you can have a seat. No swaying or anything noted. And then I'm going to, before I'm done, feel for your pulses. You have a good radial pulse, brachial pulse, popliteal, posterior tibial is down here, and then pedal pulses. And I would do this bilaterally. Brachial or radial, brachial, popliteal, dorsalis pedis, or posterior tibial and dorsalis pedis here. Okay, and I think I'm done.